urging you today to include Bill S-1049, Senator Myrie's Community Violence Intervention Program Act, in the budget.
Despite some of the strongest gun laws in the country, which have had a significant impact, New York still struggles with gun violence. In New York, on average, 370 people die by firearm homicide, and 1,522 people are wounded by gun assault or shooting by police.
Violence intervention and more so violence prevention is important, not just as a public health issue, but as a practical and a humanitarian issue.
We know that in New York, gun homicides disproportionately impact Black and brown families living in neighborhoods shaped by long-term underinvestment.
Violence intervention programs successfully reduce violence by implementing alternative public safety measures that are locally driven, informed by data, and often don't require police involvement.
People who are from the community, who know the community, that are able to go in and offer an opportunity to mediate conflict, to offer a crisis response, and they all use the public health approach.
Using VOCA funds to resource community-based services to gun violence victims allows us to interrupt these cycles of violence. And funding community-based organizations is the best way to increase access to these services.
With different community-based organizations around the borough and around the state, we have an opportunity to intervene and work with our most vulnerable using trauma-informed care-based practices, but more importantly, getting people the support that they need instead of locking them away.
What we're proposing with the C-VIPA bill is really important because it allows for community-based organizations, hospital-based organizations, to address the structural issues that influence violence in our communities.